like a roadmap. Curriculum is a roadmap of all the plan for the
Absolutely.
course.
Yeah, absolutely. What are the components that your mind is directed to? What are the what are the things
components of curriculum? Sir, एक तो hidden curriculum, visible curriculum.
Okay. Yeah.
I don't know the opposite of hidden curriculum, but I think
yeah. So, correct. So if you look at the components, not in that sense, but things that your mind goes when somebody says something about a curriculum.
So
it's the Assalamu alaikum, sir. It's the academic content. What is being taught?
Okay, content. Okay,
school or university.
Yeah, subject
content
matter.
Of the curriculum.
Thank you. So one is subject matter. What else?
How it is being taught? What will be the outcome? What is the objective?
What is the objective?
the assessment.
Assessment, teaching, learning.
Yes.
So as you
curriculum is basically overall plan of the activities that we want to conduct around the course, which not only includes the learning outcomes, the syllabi, but also how it is going to be assessed and if there is any practical component.
Absolutely. So you know a lot about the curriculum. So some of the components of the curriculum you have already mentioned. I think there is somebody whose mic is not.
आपने भी ज्वाइन कर लिया?
Can you mute the mic, please? I think
आपने मेरे से पहले ज्वाइन कर लिया है.
Let me see.
कमाल कर रहे हैं फिर.
Participant, kindly mute your mic.
I think there are few mics unmute. So let me. I don't know whether I can mute them from here. Of course, you can unmute and talk with me. Okay. Thank you. So although you are all on mute, you can unmute and talk with me. But if you get other calls or whatever, keep it mute. Right. So curriculum has a lot of components, and you know many of those components. Now you also mentioned there are two words, curriculum and syllabi or syllabus. Is there a difference? Or is it the same?
Curriculum describes how the syllabus will be conducted or how it will be taught.
You are almost there. Yeah, a very, very close answer. Can somebody improve on it? Yeah, that's more or less.
Syllabus is a component of curriculum.
Absolutely. Yeah, so syllabus is a component of curriculum. Which component does syllabus refer to?
Learning outcomes.
More than that, it's the content, subject matter. So probably in the older days, the only curriculum you had is a list of subject matter. So they called it a syllabus. But curriculum is a more overarching concept where content or subject matter is just one component. So that's what it says. Syllabus is a list of topics or content. Curriculum and more inclusive term. It includes what you said. You just now said some of these topics, content, outcomes, objectives, teaching, learning methods, timing, sequence, timetable, assessment, educational environment, and many more. Right. I see another unmute person. Right. I can mute from here. Oh, no, I can't mute. Yeah, so if you unmute yourself to answer, then mute again. Okay, so these are some of the components. We'll be looking at more components as we go by. So that's the basic overview of a curriculum. Then, I mean, if you suppose if you want to develop a curriculum or to evaluate a curriculum, then you should know all the components, and probably you should also know what questions need to be answered in the either in the curriculum development process or in a curriculum evaluation process, or simply if you want to get to know what the curriculum is, you need to ask about 10 questions. Right, let me show you those 10 questions. So, yeah, those are the 10 questions. What are the needs that the curriculum must address? So if it is doctors, what sort of I think there is another person to mute. Right, muted. Okay, so what sort of product that you are producing through the curriculum? If it is a medical curriculum, it will have to be doctors. If it's other health professions curriculum, it will have to be another health professions professional. Then what are the outcomes? Learning outcomes, what content, then what should be how should be the learning experience arranged? What are the educational strategies? What are the teaching learning methods? How to assess? What sort of a learning environment should be fostered? Then how should the educational program be communicated with the learner, and not only the learner, with all stakeholders actually? And how should the program be managed, including evaluated? How should it be evaluated? Okay, so those are the 10 questions. We'll be going through these 10 questions from now onwards. After every question, you can apply what we discussed for that question to a curriculum of your own. Right? So select a curriculum of your own that you are familiar with. And we will give you a few minutes to jot down. Even when we talk, you can jot down for your curriculum, what is this? So for instance, what are the needs that your curriculum must address? You may be already addressing it, or you may not be addressing it. So in that case, there is a gap. You can identify the gap by analyzing the curriculum through these 10 questions. We will do that right throughout the 10 questions, except question 5. Question 5 is a little bit longer question. So that's the question that I want you to address just after the break. Within about half an hour, I think you can do a good job. Okay, first question. That's the first question. So what are the needs? Doctors or other professionals? What sort of person should be developed through this curriculum? So to identify what should be included in the curriculum, we do what we call a needs analysis. Need analysis is, there is disturbance again. Oh, there are two to be muted. Right, okay. So you should do a proper needs analysis for that. So for that, you should ask from all stakeholders what sort of a person that you want through this curriculum. Or when a person who goes through this curriculum, once he or she goes through it, what sort of a person he or she should be. So obviously in health professions education, we try to develop a health professional. be it a nurse, doctor, physiotherapist, whatever. So that's one part of this needs analysis. Then there are priorities set by various governing bodies, governments, councils, and so on. So they are also based on the need of the country or the region or whatever. Then epidemiological data may be also very useful, because those data will tell us what are the predominant health problems of the country or region or wherever these graduates will serve, because those should be included in the curriculum. So in your region, your country, Rocky Mountain spotted fever is not a prevalent disease, then there is no justification of including that in grade length and grade depth. No point in doing that. But just mentioning may be okay, because graduates sometimes cross borders, migrate, and so on. But predominantly you are developing for your region, your country. And that should be very clear, because you can't teach everything under the sun. So if you want to prioritize, this is the way to prioritize. And without this focus, you'll be all over the place without any focus. Okay. By the way, if you have any question, you can certainly discuss, unmute, talk, and then mute again. Right. So nature of the professional. Is he working in the community, hospital, investigators, laboratory specialists? So there can be many such. So you need to know about that. So if you are dealing with an undergraduate course, then probably you are thinking of a day one basic professional, doctor or a nurse or whatever. Right. Then the level. Is it for independent practice, restricted practice, or further stage of training? All these are things that we need to identify, understand, if we want to develop a good curriculum. Right. So we are back to the activity one. Take a piece of paper or open Word in your computer and think of your curriculum that you have in mind. What sort of needs does it address? Does that curriculum address? Are there, what's the reason for establishing your program? So then you should be clear about the product that you produce. So there are 3 questions to answer: program content, nature of the physician or the professional, and the level. I'll give you a minute or two to do that, because as we go along, of course, you can't write a lengthy description because we are short of time for that, but at least jot down. Or if you haven't thought, if you don't know, then think of how you will get to know this. What sort of a needs analysis will you do? Whom to ask from? Just one word is maybe enough for the last two questions, the level and the nature. But this content requires a little bit more elaboration, but don't do it too much. At least say, define the product that you want to develop or that you are developing. Okay. Are we good to go? Let me know if I'm.
Yes, sir.
Okay. Right. So that's activity 1. Then the second question. What are the outcomes of the program? So for that, first we should realize what are outcomes. Outcomes are, some people call them in different words, different people call them, some people say they are what we call general objectives. That is the overall objective of the program. But that is really very program-centered way of, or course-centered way of identifying the overall purpose. But outcomes are more about the product that we develop. Who is the product that comes through this curriculum? Can we define that person in terms of the broad abilities that that person should have? So outcome is a culminating demonstration of learning. It is what the student should be able to do at the end of the course. So there are different frameworks of outcomes. So here is one framework where you think of the tasks that the product will do, that is the graduate will do after graduation, and how those tasks will be approached, and the professionalism with which those tasks will be discharged. So each of these can be broken down into its component parts. So for example, the tasks, the inner circle would involve these abilities. If it is a healthcare professional, clinical skills, practical procedures, investigating a patient, patient management, health promotion, communication, data handling. Then, so that's called the technical abilities or technical intelligences. Then there are non-technical intelligences, which are equally important, especially these days. So basically the knowledge of social, basic and clinical sciences, appropriate attitudes, ethics, understanding, legal responsibilities, then appropriate decision-making skills, clinical reasoning. So all those will make the graduate perform those tasks with awareness, with a sound background, a scientific background. Because otherwise, these tasks, what you found earlier, these tasks can be taught in a very mechanical way, which will not give the performer an in-depth understanding why we are doing. That is like just following a protocol. But you don't know why you follow that protocol. Now, that is not how a professional should be acting. Maybe a technician can act that way. Even a technician should have some background knowledge as to why he is doing, but that may not be that much. But a professional cannot just follow a protocol. He should know why he is following it. So that why comes from this. This is the basis for the professional actions. Then finally, the final term, the outer term, outer circle actually, outer circle in that 3 circles that I showed you. Tasks, approaches to tasks, approaches to tasks would be these, and then finally, right person doing it, that is personal intelligences, and understanding of the doctor's role in health service and lifelong learning. So here is another outcome framework, a similar framework. You may be familiar with this. I'm just giving examples of outcomes. You need not follow any of these. You can have your own set of outcomes based on your needs analysis. That would be the idea. However, these frameworks have been also made by doing a needs analysis almost globally. So they more or less will fit many courses in the world that produce healthcare professionals. And the evidence is that. So you find this framework being used in Canada, US, Europe, Asia. So because these are so generic outcomes, these are broad abilities. These are broad abilities also. These are broad abilities. They are not small abilities like define this, define that. No, explain this, describe this. No, those are not. If you break this down, yes, they will come to that. But at this level, we are not operating at that minute granular level. We are operating at a much more encompassing level, overarching level. Right. So what is the difference between, I in fact told you. So if you break down any of these, you will achieve, you will go to a lesson level where you can write lesson objectives or lesson outcomes. So the relationship between objective and outcomes, objectives are basically a more granular ones, which are really lesson level ones, or maybe even a modular or a course level ones. And several such objectives will develop or will feed into a competency that is a broader ability. And several of those competencies will, when collected together, will be a meta competency. And of course, several such meta competencies will develop the curriculum. So actually, these meta competencies are the outcomes, broad abilities, which can be broken down into, and which will have to be broken down into smaller abilities when you write the specifications of the curriculum in terms of courses, modules, subjects, and within them, the lessons. Right, so we need to identify an outcome framework. Of course, as I said earlier, educational jargon is funny because for the same thing you have people use many names. Here are some of them. So whenever you come across any of these names, that is what I do. First thing I ask myself, I try to understand is, and if I can't understand, I'll ask them, those who gave me the curriculum. Are you talking about the graduate that is produced at the end of this program? Or are you talking about smaller courses or smaller modules? Or are you talking about lessons? Those are the three broad things: lessons, then modules or courses or subjects, and then the entire program. So you need to be very clear, because otherwise you don't know what they are talking about, and then you can't really comprehend whether this is appropriate or inappropriate. So at a program level, what you saw are all program level, broad abilities, not small ones. Define this, define that, that's not the purpose. Right. Can we identify a set of outcomes, or you can use internationally recognized, the two outcome frameworks that I showed you. One is from Canada and one is from the UK. Such one. Actually, the Scottish doctor outcomes, the first one, the 3-circle model, or any other, or an outcome framework that you already use, which you have identified through a needs analysis and all that properly for your setting. Either way should be okay. Either use your own one, which you have already done the homework and identified, or use an internationally accepted one. Either of the two would be fine. Shall we quickly jot down the outcome? So we are developing in a way a broad framework of a curriculum for one of your curricula. So at the end of the 10th question, you should have a broad framework of your curriculum. Obviously, you can't develop a brand new set of learning outcomes in this time frame. And even if you have all the time, you should not do it alone. It should be a collective effort, and lots of data should be there for you to back your decisions as to include which outcome. All of that is not at your disposal at the right now, right? So therefore, it's just a matter of selecting one or relying on what you already have. But identifying it and documenting.
So can we see the question slide once again?
Okay. You mean the 10 questions or?
Yes, sir.
Okay, I'll show you, but we are at the second question now. So now what you need to know is what is the outcome framework on which your curriculum has been built. So those are the broad abilities that will define your graduate. What sort of broad abilities that the graduate should have. If you don't know such a thing, I would suggest, and if you are from a health professions course, I think this sort of outcome framework would be good enough just for today, but later you will have to, you can develop your own. But if your curriculum that you are addressing today, that you are analyzing today, already have already has a outcome framework, then please use that. But if not, probably this is simple enough. Okay, then shall we move? If you don't have anything, use CanMates. And if you could not copy that, just Google CanMates, you will get that outcome framework. So these are broad abilities. These are just one or two word abilities. Right. You wanted the 10 questions. Here are the 10 questions, and we are now dealing with question number 3.
Yes, thank you.
Right. The third question is, what is the content of the program? Again, it should be based on a needs analysis. So contents are topics, subjects. Topics may be within subjects. So you can look at it in different ways. Here is probably a very patient-centered way of looking at the topics. So things that need to be included. So you can think of the common ailments that patients present, like abdominal pain, chest pain, headache, so on. And then see to address that health issue. If you are a health professional, what sort of knowledge should you have? And all those will be your content. Of course, easier way is to just go by disciplines, anatomy, physiology, biochemistry, microbiology, and then list out. The problem of doing that is when we identify content for those subjects, because those subjects are so vast, we may include in the curriculum things that our graduate really does not want at that level. If he specializes in one of those subjects, yes, one of those disciplines, he may need it. But if it is an undergraduate course, which does not produce a subject expert of that discipline, then some of the, or most of the content that we identify through a discipline-based approach would be irrelevant, most of the content. But if you adopt this approach, the patient presentation type of approach. Even disease approach may not be ideal because some of the diseases are so rare, you don't need to address them. Unless you first identify the most prevalent, must-know type of diseases and must-know conditions to save patients. That is, if you miss it, it will harm life. It will be life-threatening. So such things are the ones that should be considered as the curriculum content. So this approach is probably the best because you are considering how patients present. And based on that, what should be taught. So you will not teach anything irrelevant. Right. Can you identify the content? You can list, an easiest way is to list the disciplines, but be a more innovative. At least look at, maybe you can look at different body systems. Even if you don't do this, this will take, if you have thought like this earlier, you can easily do it. But if you haven't, probably at least one of the common ways of identifying content is based on body systems: cardiovascular system, respiratory system, endocrine system, neuro system, and so on. That's your activity which you need to do now, just now. Few minutes, 1 or 2 minutes, just jot down. If you have missed anything during your break, you can replenish it and beef it up. Right, let us move. Question number 4. Should the learning experience be arranged in a set order? Of course, yes, because we have to offer the content in a logical way. So you may first learn about the normal structure and function before you learn about abnormal structure and function. So that's a logical way of looking at it. First, you should know what is happening before you try to fix a bug in the system. So that's a logical way of looking at it. Or there should be some logic in your either from most easy to the most difficult. Some way of looking at the content which is logical and which is easy to understand. So the most traditional way is this basic medical sciences, pathological, so normal structure, abnormal structure, and then the practice. But that has been an outdated model now. Why? People realize that when you learn this in the first year or first 2 years, now it's mostly first year. And when there is such a long gap between learning this and applying it back to practice here, students have almost forgotten everything that they learned here when they are called upon to apply it. So this model has problems. So to overcome those, what they have done is, nowadays a modern curriculum will not teach something and ask the students to wait for years and years before applying. Modern curriculum would do is teach and then also give the chance for application almost immediately, with a very short gap between theory and practice. So basically, bridging the theory and practice. Plus, if you learn these as pure sciences, then the practical implications of these pure sciences, students may not immediately comprehend. So therefore, organizing not as sciences, but in some other way which is more practice related, like body systems, because diseases happen in body systems, cardiovascular diseases, respiratory diseases, dermatological diseases, and so on. So looking at that way, again, is a way of bridging the theory practice gap, because how you have learned is exactly the same way that you apply in practice. So therefore, this model is somewhat outdated. So what we should, so the model that is currently applicable is the model where all these are taught together, rather than in separate blocks, right? So how should the learning experience be arranged? As I said earlier, as we go along in a course, there should be increased scope. That is, breadth and the difficulty should be increased. Increase utility. Students should be able to use the content that they learn in multiple situations, and those situations should increase as they go along the curriculum. And increase proficiency. What they do, they will do with more accomplishment, more fineness, accomplishments. So it's all about coherence and cohesion, and natural progression of the student learning. So this is the inverted triangle that I said earlier. So now basic sciences and clinical sciences, even in the first year, of course, the basic sciences are a lot, but there will be some clinical sciences, clinical content. So as you move along, basic sciences get shrunk and clinical content gets bigger. By the time the final year comes, almost everything will be clinical content. So rather than those 3-block model, this inverted triangle model will give students the opportunity to apply then and there. Of course, in the first few years, the opportunity may not be much, but in the final few years, opportunity will be quite vast. Are there any questions? So this can go on, this model can go on in an iterative fashion, where you first learn the basic normal structure and function, then abnormal structure and function, and then predominantly application. But even here, they will do application, even in the first two loops. Right, that's the two models superimposed on each other. Any questions? So here the basic sciences would be basic normal structure. Here the basic sciences would be a normal structure, but then there will be a heavy component of clinical contact also. Here, all that were learned in these two cycles will be learned in a more clinically relevant context. Right, it's your turn now. Identify the model or the structure or how your content has been arranged. You can identify how it is arranged right now, and you can even propose ways to improve. If you think that the model the way that the content had been arranged is not proper, not ideal, but first you have to identify what is the way that that's not connected to our, yeah. Okay, can you do that? First is just to identify how it is done right now. Then you can think of, based on what we discussed, whether things can be improved.
Sir,
Yeah.
Sir,
Yes.
the curriculum.
Yes. Yes.
Okay. Sir, the curriculum that we are being taught, that we teach, that we utilize to teach the medical students in our colleges, isn't it the same which you are just describing? The inverted triangles and the iterative model, isn't it the same?
It's up to you to decide, because I don't know your curriculum, but I guess it is the same, because most medical schools will adopt these methods. But then the question is, how much are you doing this, or how can it be improved? Should there be more clinical contact within the first few years? How can you expose the students to clinical material during the first year so that they can apply the basic sciences that they learned to explain symptoms, physical signs, and so on, or even just the normal function of the body? Is that application prominent in your curriculum, or can it be further developed, further fine-tuned? Okay. Because I guess here you will, at least you would have identified what sort of a curriculum you can.
Sir, in the first years, when the undergrad come in the first year, we start the clinical teaching with the by giving them the clinical scenario, and then we start our session. Is it right for the first year students?
Of course, I mean, that is your curriculum, then philosophy. That is, you are exposing the students to clinical material at the onset, which is quite appropriate if you sort of support the student in an appropriate way.
Okay, thank you, sir.
Okay. Right. Question 5. What educational strategies should be employed? Here, we are not going to do this activity right now because this will take some time and we will be doing after the break. You can do it and I will reappear maybe in a half an hour or little more than half an hour. So you can do a proper analysis in terms of educational strategies. What are educational strategies? They are broad approaches to a curriculum and actually broad approaches to learning. So here are a few strategies or broad approaches: student-centered, problem-based, integrated learning, community-based learning, elective-driven learning, and systematic learning. So if these are approaches, these approaches are not just there as in a standalone fashion. These approaches also have an opposite of this. So here are the opposites. So student-centered versus teacher-centered, problem-based versus information gathering, integrated versus discipline-based, community-based versus hospital-based, electives versus uniform, systematic versus apprenticeship-based. So knowing these antonyms or knowing these opposites will make us understand these approaches better. So what they say is each of these, what we call continua, each one of these is a continuum or a spectrum where there are two opposing poles. So student-centered versus teacher-centered. So student-centered is what? Teachers do not teach at all. Teachers facilitate students to learn. Teacher-centered is what? Teachers do all the teaching. They give notes, they do everything. Students only have to learn what the teacher has taught. Now these two ends are two extremes. Most of the time, those two extremes are not represented in our curriculum. Most of the time, it's a mixture of these two extremes. Now, what you have to do after the break is that identify where in your curriculum each of these spectrum stands. Is it here? That means more student-centered. Is it here? That means more teacher-centered. And then identify, give an example as to why you say that. Otherwise, you can just blindly identify. No point in that. Give an example also. Problem-based versus information gathering. Information gathering is all the content is given to the student. Whereas problem-based is you give a problem, and when the student tries to solve that problem, student gathers new information. So information is given through a problem. Actually not given, acquired by the student. Teachers don't give. Teachers give the problem and help the student to make sense of the problem. Facilitate, but never give information. Information has to be gathered, acquired by the student when they try to solve the problem. So that is problem-based. Integrated versus discipline-based. Again, discipline-based is easy to understand. You teach in disciplines: anatomy, physiology, biochemistry, microbiology, parasitology, pharmacology, pathology, so on. They are independent components of a curriculum. That is discipline-based. They don't speak to each other. Integrated approach is not that. Integrated approach is more relevant to practice. None of these disciplines are practiced in isolation in actual clinical practice. Any patient, for any patient condition, you will have to draw in from many of these disciplines in order to treat that patient. So if you learn in disciplines, you will have to unlearn that when you go to clinical practice. But if you learn in a way that it can be readily applied to practice, like in integrated learning, then you don't need to unlearn when you go to clinical practice, because you have learned in the same way that you have to practice. So one of the most common ways of integration is body system based integration. cardiovascular system, respiratory system, and so on. Then community-based versus hospital-based. Hospital-based is the entire course runs in the hospital, program runs in the hospital. Here, the entire program runs in the community. Now again, those two extremes are mythical, non-existent. We are somewhere in the middle. You have to identify that middle. Same with integrated and discipline-based. We are somewhere in the middle. Again, identify where you are. Electives versus uniform. Uniform is all students follow the same program, same timetable. Whereas if you include electives, students have a chance to select what they want to learn. Again, total elective curriculum or 100% uniform curriculum, they are not common nowadays. Especially those days, yes, 100% uniform curriculum was the order of the day, but no longer. So again, we are somewhere in between. Identify where you are. Systematic versus apprenticeship based. Again, long time ago, how doctors and other health professionals were trained was the trainees went behind the trainer, and whatever the trainer practiced, they learned. So it's apprenticeship based. Whereas nowadays, we don't do that. The problem with apprenticeship based learning is that you only learn what your teacher does. So if your teacher does not treat a particular disease, you also don't know how to treat that. And it's very opportunistic. Maybe during your training, although the teacher is capable of treating certain patients, those patients did not come to his clinic during that time. Then they are lost. Then you as a student did not experience how those patients should be treated. So it's very opportunistic, whereas systematic curriculum ensures that a core group of diseases and complaints are seen by the students before they graduate. So it's a way of ensuring that all students have the same abilities, or at least the same exposure, or at least a similar exposure, so that no student is disadvantaged due to the practice peculiarities of a particular teacher. So likewise, you can identify, but this is an example, but you will do that.
Sir, can you please explain the electives and uniform part?
So elective means that students select whatever they want to learn. So there is a basket of modules or courses or subjects. Students go and say, I want to do this, this, and this. Entirely up to the student. But uniform means no, that is not offered. That choice is not offered to the student. Students are given a timetable, a curriculum. All students, like it or not, will have to follow that. Now, in the past, all curricula were uniform. But now we know that within a curriculum, everything cannot be taught. So what we need to only focus on is the core curriculum. What we say is the must-know things. Others are, there are such a lot of others. You can't really teach everything. So we offer all the others in a menu and ask students to learn some of them as they prefer, depending on their likes and dislikes of a particular subject or a particular discipline. But the core is common to all. Is that clear? Are we okay? So this is the activity which you are not doing now. Do it thoroughly. If you don't have this, please take a photo of this or whatever, so that you will know what to do. Actually, take a photo of this. No need on this process, because these processes are artificial but you can do a more genuine job and give an example to each of these 5 as to why you selected this point, for example, why you selected this point, and so on. Right. We are on to that's sort of homework, not homework. I mean, after this small presentation, you would do it. Question number 6. What are the teaching learning methods? They are easy. They are easy because lectures, group work, you know all that. Tutorials, problem-based learning sessions, and so on. Clinical learning sessions, community learning sessions. And also, all the timetable will not be filled with those methods. There may be floating time, private time, self-learning time, and so on. So what you need to remember is teaching learning methods should address all the learning outcomes that we define when we define the graduate. Question number 2. Question number 2. Right. That you can jot down now. What are the teaching learning methods you use? But once you do that, maybe after I finish, when you plot that SPICES model, those learning approaches or curriculum approaches, you can think about the different teaching learning methods for each of those strategies. Why we identified the strategies first is based on the strategies, our teaching learning methods may change. So if you have a very systematic clinical training program, you will have workplace-based assessments and so on. Workplace-based learning structured. Whereas if you are for an apprenticeship-based curriculum, then you don't need to have those. So it is based on the strategy. If you have a curriculum which promotes problem-based approach, then PBLs will be a major component of your curriculum. So methods are dependent upon the approaches or the strategies. That's why we consider as question number 5 strategies before we went on to identify the teaching learning methods. So please jot down a few. You can improve that during your free time. Okay, question number 7. What are the assessment? Again, it's damn easy. So this is what we call the Miller's pyramid. Miller identified 4 levels of learning. Knows is just recall, knowledge. Knows how is whether you know how to apply them. So all these are cognitive domains. Then no point in only knowing how to do it. You have to do it and show. That shows how. That is doing it to show somebody, demonstrating your ability. But this is not demonstrating, but actually doing it in day-to-day practice. So methods used for these 4 tiers will be different. MCQs, essays or structured essays or short answer questions would be knows. Then scenario-based questions, whether they are MCQs or structured essay questions or short answer questions, would be knows how, but all those are written exams. Then shows how would be clinical exams. OSCEs are the order of the day. In the past, we used short cases and long cases. And this is all about workplace-based learning. Logbooks, portfolios, mini CEX, DOPS, case-based discussions, you name it. So unfortunately, we don't have a single method to address all these levels. So you have to use a battery of assessments to address all these levels. So again, we can use these methods some of these methods may also be used for evaluation, because assessment and evaluation and monitoring are often confused. So you can use the results of these methods to evaluate the curriculum, whether the students are good in which ability. But also you can use separate evaluation methods, monitoring methods. Questionnaires, meetings, focus groups, diaries, that's for students. For teachers, committee structure, personal approaches, questionnaire surveys. So teachers are in various committees, right? So you can look at the committee structure and evaluate whether this is appropriate or not. And then you can interview teachers and ask for their personal approaches or questionnaires. Institution, then academic standards and processes can be studied. Professional bodies, so there may be regular visits by professional bodies for accreditation purposes, or they may send a questionnaire. Then again, the government would also do some quality assurance to ensure that the graduates are at the appropriate level. And also, there can be even at a public level evaluation or monitoring, but that's not common. Okay, forget about the evaluation part. I just mentioned that, but please write down a few assessment methods. At least one or two for the record. What you do. Later you can think of, okay, we don't assess at the best level. How can we do it? That is a question to be answered later. Question number 8, what sort of a learning environment? So learning environment encompasses everything. Teaching, learning, assessment, recreational activities within the educational setting, clinical learning settings, and so on. Even the hostels that the students say, the recreational sports activities that the student participate, all those are there because that is part of the broader educational agenda. Those activities develop the students personally. So you can measure these. This is a common measure, the Dundee Ready Educational Environment measure. So it's basically a questionnaire, and it has about 50 questions, but those 50 questions are grouped into 5 things: perceptions of teaching, perceptions of teacher, academic self-perceptions, perceptions of atmosphere, social self-perceptions. So you can read more about that, but in learning environment is an overarching thing. It includes everything that the student comes into contact with while learning in this program or course. Nowadays, the virtual environment is a big part of what we are doing even now. The learning management systems, the platforms, e-learning platforms, video conferencing platforms nowadays form a big part in the curriculum, in a learning environment. So think of the learning environment that you have in your curriculum. At least list them in physical terms and in human resource terms. Human resource terms, teachers, administrators, and so on. Physical terms, lecture halls, small group discussion rooms, assessment halls, examination halls, playground, cafeteria, hostel, gymnasium, computer suite, library, sort of, depending on what you have. Because all those are there for a purpose to support the curriculum. They are not independently there, just for the sake of being there. So we can identify what is needed for our graduate based on that and decide what are the facilities we should offer. List at least a few, you can develop it further. Number 9, how should the details of an educational program be communicated to a learner? Now, the most traditional way as a student, I got to know about the curriculum only by one way. That is the timetable. Actually, I didn't know a curriculum actually even existed. But now there are many curriculum documents, timetables, statement of outcomes, prospectus, website, newsletters, student handbooks, staff development seminars, study guides, staff student meetings, curriculum mapping. Nowadays, unlike in my day, students go through all of these before they come to learn, before they select a curriculum, before they select a program. So what do you have? How do you communicate with students and other stakeholders? Accreditation bodies, external examiners, reviewers, whatever. Or even general public, because website is public, in the public domain. At least you should have a timetable. I'm sure you have much more websites, prospectuses, and all. Final question. How should the program be managed? So ideally, there should be an organogram like this. Different phases, whatever. You start with some syndicate, a board, which governs the overall curriculum. Then you have smaller committees, curriculum committees, and so on. So you can draw up your own management structure. Right, that's where we will stop. For the moment, we'll take a 15-minute break. And after that, please see to it that you develop the spices thing. And as well as you can also complete whatever you have jotted down. If you wanted more time to include more teaching learning methods that you use, more assessment methods that you use, if you use more data for your needs analysis, all that you could certainly go through and then develop. But at least, even if you do that later, at least do the spices thing. I can leave this with you, this screen, so that you can, if you did not take note of this, you can look at this, but take note of this, please. Take note of this and then identify where you are like this, sorry, where you are like this, but with examples and reasons. Is that clear? I hope.
Yes, sir.
Okay, thank you. We'll see in maybe little more than half an hour. Take the break and then work on this. Okay?
Yes, sir.
Okay.
3 pebbles.
spices?
They are the
So-
ones which will be
The
used
spices
to-
model. So question 5, the answer is on question, actually slide 5. The previous slide has the answer to this question.
Okay.
Okay.
Oh.
So now the teaching learning method is the one that you address through this slide 6, right? So this answer is question 5, slide 5, right? Slide 5,
Okay.
on slide 5, you have this answer. Now this is about all teaching learning methods. That is the next question, isn't it?
G.
Yeah. Okay, go ahead.
This is how we, yes.
I think you skipped how the curriculum should be arranged. Maybe from basic sciences to clinical, we talked of inverted
So
triangles.
next, sir.
That's what you missed, I think.
Hearing you. I think I can't.
You are breaking. I cannot hear you very well. Your voice is breaking, probably. Maybe. I hope it's not my problem, because I know this machine also be a problem. I don't know.
Yes, sir. This is everyone's problem.
Okay, I can hear you very well.
Because I am from other country.
Right. Okay. So it's not my machine. Okay. Thank you for letting me know. Because I was worried it's because this machine also, the screen, I could not move and voice was not coming. Okay, we lost her, I think. She may come back.
Yes, sir. There are internet issues in Pakistan, I think. I'm from Saudi Arabia.
All right. Okay. Are you working in Saudi Arabia, or are you?
Yes, sir.
Right,
Yes,
she
sir.
has
I'm
come
working.
back. Okay.
I'm
Okay. She has come back.
basically Pakistani.
Okay, she has come back. Okay, welcome back.
Sir, can we discuss this now?
Oh, I think, yeah, as you say, if you are meeting tomorrow, we can do it a better job, isn't it?
Okay.
Okay. So at what time, let me know. Email me. I mean, Dr. Aska would email me if you tell her.
Sir, we will ask the organizers in the group to arrange.
Yes. Okay. So I can actually accommodate I can be flexible today, tomorrow, and day after tomorrow, because being weekend.
Okay.
So let me know. Okay, then I am going to.
Okay, sir.
Okay, I think I have to make one of you. I think Dr. Aska may be the host before I leave. Otherwise, all of you will end the session. Let me see, Dr. Aska. Yeah. All right, this Edulife thing I will make. Co-host you are anyway, no? I will make you the host, then there is no issue. Make host, okay. Done. So I can leave. Okay, see you tomorrow or day after tomorrow, let me know.
Thank you, sir. Thank you very
Okay.
much, sir.
Thank you.
Assalamualaikum, I'm Dr. Lariat Kamar as an organizer. आप लोगों के अगर कोई क्वेश्चंस वगैरह हैं इससे रिलेटेड तो आप भेज दें, और बाकी जो आज की एक्टिविटी थी उसके लिए मूडल पे आपको हम लोग लॉगिन कर देंगे और सर को भी उसका एक्सेस दे देंगे ताकि आपने जो आज एक्टिविटी का काम किया उस पर अपलोड करने में शक, अगर सब एग्री करते हैं तो।
जी, और आप सर के लिए टाइम भी तो ऑर्गेनाइज कर दे जैसे वो रिक्वेस्ट करे थे।
ठीक है, ठीक है। असाइनमेंट की वो जो आज की एक्टिविटी है उसके लिए सब लोग एग्री हैं कि मूडल पे हम कर दें और आप उस पे अपलोड कर लें।
जी 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 जी।
ओके ओके। बाकी अभी 3:30 पे दोबारा ये सेशन होगा डॉक्टर कामरान सतार का।
जी ठीक है।
ओके, आप लोग रेस्ट कर सकते हैं, ब्रेक ले सकते हैं।
ओके, थैंक यू।
ओके, अल्लाह हाफिज।
Thank you, ma'am. Thank you.